Hi, this is Dr. Corey Maas on Looking Your Best. I wanted to talk today a little bit about the cost. The cost of rhinoplasty is something that a lot of our patients ask about. Obviously, it's a serious concern for everyone to be able to afford procedures. And I talk to them in terms of investment because rhinoplasty, or changing the shape of your nose, is a lifelong investment in your appearance, and it's all about balancing your features and balancing symmetry with your face, which improves obviously for the long term, forever. So when we talk about things that are long-term investments, obviously it changes the discussion a little bit about cost as it relates to this, but it doesn't mean that up front or at the beginning it isn't impactful for people. Now there's lots of different kinds of rhinoplasty that we do. In the US, most of the rhinoplasty is reduction rhinoplasty. That's either bringing a bump down or making the tip more refined. But in Asia, many patients are actually building the nose up in some of the Indian subcontinents, but China in particular and Japan, there's a lot of augmentation rhinoplasty. And augmentation rhinoplasty is one of those areas where we've explored doing small injections of fillers to help to augment the middle part of the nose, the bridge, we call it the dorsum, or even the tip in some cases, or at the base of the nose to help bring out the nasolabial angle, which are important features of the nose. And those procedures can be done for, well, in or under $1,000 really. When we start getting into surgical procedures as it relates to the nose, we divide them into really minor rhinoplasty, which is often revisions that are very small, taking down a little bony spicule or a small dorsal hump, or correcting a small irregularity of cartilage. And those start in the few thousands of dollars range for most patients. And then there's the going to the extreme end, and I've done and reported lots of these. There's photos on maasclinic.com and drmaas.com of what we call total nasal reconstruction, where I'm taking a patient and building them a new nose from either bone or cartilage that can be harvested from the patient, or it can be used from autologous tissue banking. And in those cases, which can take 7 to even 12 hours in some situations, obviously those are a whole new world of, up into the tens of thousands or beyond dollars. And that really, in many cases, can be largely covered by insurance. The average cosmetic rhinoplasty varies by area, and I can tell you that it's very different in San Francisco than, for example, it would be where I just left teaching in Nanjing, China, where the cost of living is going way up and things are expensive. And in fact, in some areas of China, they've eclipsed the prices for medical care that we have in the United States. Typically, most rhinoplasties that are not complex, very simple, straightforward, bringing down a bump, are in or less than around the $10,000 mark in most practices. And as soon as you add complexity, and this is how we try to grade it really, by the time and complexity and the risk of the procedure, they can go up from there. But what's important to remember about the cost of rhinoplasty is that it's different for everyone. It depends on your condition, it depends on whether you've had previous surgery, it depends on the complexity of the procedure and the anatomy that's already there, the support structures, etc. And I think it's important to remember that rhinoplasty in particular is a blend, a hybrid between function, that is nasal breathing, and form, how the nose looks, fits, and balances with your face. So I gave some big ranges, and unfortunately that's all I can do, but I'm happy to at any time do a consultation, either live or virtual. And you can do that by writing me at drmaas.com. Visit our website and hit the Contact Us form. I answer all of those emails. You can send in pictures, and if you allow us to, we'll discuss them on the website. We can block out your eyes, or you can do it privately. Either way is fine. But in all cases, I'm always very happy to answer questions and get people oriented to, what the steps are, what the recovery's like, and what the costs are in general until I've seen you live. And that's something you're entitled to and certainly should know about for planning. As always, it's my great pleasure to be with you. And if you have any questions, don't hesitate to call or write us. This is Dr. Corey Maas on Looking Your Best.